Hi, my name is Rachael Romo. I work here at Texas A&M Small Animal Hospital in the operating room. I am a registered veterinary technician. I graduated from Bellray Institute in Denver, Colorado. I took a few years of regular college courses, core courses, before I started at Bellray, but then I realized I really wanted to get into the veterinary field a lot quicker than vet school, so I decided to go to Bellray, and who wouldn't want to live in Colorado anyway? So I moved up there, and then it's a 2-year program that I graduated from. I applied for an internship here at A&M and got lucky and had a job opening here in the operating room. And I am the head technician for surgical equipment for orthopedics. So anything to deal with orthopedics outside of circulating, I take care of ordering and everything to do with that. Today I'm going to demonstrate how to properly wash and pack and wrap a general's pack. This is probably what most people will have in private practice as well. And then after that, I'm going to go through a few important things that you really need to be aware of preparing an operating room for a surgery. So first things first, I'm going to go through what we use to clean instruments. So I don't have any dirty instruments because that would be a little messy. But what we use here is a product called Endozyme. It actually breaks down all the proteins for you pretty well. So I don't know the exact dilution, but we just use a few pumps per bucket that we use with all our dirty instruments, and we go through so many surgeries that we tend to turn over a lot quicker than your general practice. So we'll have a bucket, we'll let it soak. You have to let it soak at least for 10 minutes, and then that way once you get to scrubbing it, it's pretty easy to scrub. So I have an example here. This is just a regular towel clamp. Usually the endozyme will get most of the bacteria and everything off and the clumped blood and everything, but we like to scrub in the areas that maybe the surgeons are touching, which are these finger rings, and then this area which is called the box lock, and then of course any of the parts that are going to be touching your patient. So we make sure we get a good scrub on those, and then we'll put them in a little basket that has holes in them, and then once you get all your dishes washed, you rinse them off, and then we'll dump them in we call it instrument milk. It's actually an instrument lubricant. It prevents your instruments from drying out and rusting once you steam sterilize. I have everything organized already on a ring for you. Usually in a general's pack we have Alice tissues, your regular towel clamps, basic scissors such as your sharp blunts, Mayos, Coolies maybe, Metzum bombs, and then a few Kelly Cryles and other hemostats, whichever your surgeon uses the most. I'm going to go through a few instruments with you. This is our general's pack. General surgery meaning your typical spay and neuter. So anytime that we have general surgery, we'll come in and we do about 3 at a time. So this is just basic instruments. We keep 4 Alice tissues, forceps, which usually will clamp your patient drape to your quarter drapes, and they look kind of like this. It'd probably be best to Google a picture of them, but so these are basically not towel clamps, but patient drape clamps, and then we'll set them all on this ring to keep them organized, and so that because otherwise they'll get tangled in your pack, and you don't want that. It's really nice for the surgeons to pull these out nice and neat, and that way they can get their surgery done. So this is a Carmalt hemostat. The way we were taught to remember at Bellray is that the Carmalt candy runs very smooth, and so the striations on this particular hemostat goes a long ways down the hemostat. So that's how I remember Carmalt. So we have 3 of these in here, so we just set those in here. These are called Kelly Cryles. Kelly and Cryle are 2 different hemostats. One striations of the hemostat go from the box lock to the tip, which is your crial, and then Kelly will stop right here halfway. So that's your Kelly crial. Hemostats. We don't really typically care whether we have 3 crials or 3 Kellys. So in this case, this pack has 3 crials. These are going to be your mosquito hemostats. Mosquitoes meaning tiny, I guess. I'm really not sure why we call them mosquitoes, but they're just basically baby crials. They have a much more delicate tip and mouth, and used for much more smaller tissues, I would think. In that case, we have 4 of these. They come straight and curved tip. I don't know if you can see the difference. And actually, that smaller one, whoops, that smaller one in the middle here is actually a different kind of hemostat, if you can appreciate the different lengths here. So the longer length is the mosquito hemostat, and the smaller one is called a Hartmann. But obviously, we don't discriminate against size, so we're just going to put all 4 of those in here. This is a typical needle holder. This is actually a pretty small one. Like I said, I do a lot of the orthopedic instruments, so the orthopedic instruments or needle drivers that we have in our orthopedic packs are much, much bigger than this. But they call them needle drivers for that reason. They are used to clamp the needle, and they use them to suture tissues, skin, everything you need to sew up. So we only have 1 of those, so tell your surgeon not to drop it, otherwise you'll have to go get him another one. So scissors. Scissors are pretty important because they're used for different purposes. Your regular either suture scissors or sharp blunts, sharps. These are sharp blunts, so if you can appreciate the blunt end and the sharp end. And they use these for inanimate objects here. So suture material, if you need to cut your patient drape hole a little bit bigger over your incision site, things like that. These are Mayos and Metzenbaums, and I can give you a good tip here. Find a place where you can get your hands on these, because it is very difficult to distinguish the different scissors unless you have them in your hands. The Mayos are much fatter and they're much thicker. So I don't know if you can appreciate the size here. And these are going to be your Metzenbaums, much longer and more delicate. And then there's actually another scissor that I don't have here that are called Coolies, and it's exactly between the 2 of these. So thicker than the Metzenbaum, but just as long as the Metzenbaum, and much thinner than the Mayos. So we have 3 scissors here. And then these are our tissue clamps, or towel clamps, I should say, properly. And these are very traumatic. They use these, the first thing you do when you're scrubbed in, a surgeon or vet student will take a quarter drape and drape around your incision site, and take these guys and clamp the 4 corners, because you'll use 4 quarter drapes to block out your incision site, and you'll use these to clamp the towel or clamp the quarter drape to your patient's skin, actually. And so if they're not under anesthesia properly, they can feel these. So we'd like to make sure that we're ready to start surgery with your anesthesia, either technician, or in this case we have our 4th-year vet students running our anesthesia with a registered veterinary technician or a trained anesthetic technician. So once you have all your instruments on a ring, some instruments don't come as easily made with finger rings, so I have a couple here. These are your Brown Atzen forceps. They use these practically for everything, so if you're in general practice or anywhere really, you're going to have a pair of these. These Brown Atzens, I would look up the tip if you can't see and appreciate the ends here, but it has to do everything with the teeth at the end. So they're thumb forceps, so you can kind of guess what they're going to use. They usually use these to hold tissues while they're suturing, really anything, just to hold the tissues. Better to get a hold of the tissues with thumb forceps than your fingers. So the last 2 instruments here, this is a spay hook. They use these to go in and grab the uterine horn and pull them up. They're much easier than trying to dig around all those organs in there and finding what you need to. spay an animal. And this is going to be your blade handle. This is really a blade handle. You place it, you want to be very careful. I'm not going to demonstrate how to put a blade on here since we're going to be packing this pack, but make sure that you get trained in that if you ever get to learn how to do that. It's very important because we have people either cut themselves or cut through the table drape and things like that, so that's really important to know. So usually when you're packing, or washing and packing and wrapping, you want to wear a booth. At least that's what our protocol is. And the reason is same as an operating room. You want to protect your patient, the operating room, your instruments from any hair that could fall, any skin cells, at anything. But in this case, the booth is going to protect the hair from falling into my pack, because whether they call it sterile hair or not, if they find a hair in a pack, you should pass it off and get a new one. So in order to prevent my hair from falling into this pack, I'm going to put it up. So I'm going to set all my instruments aside. Now, wrapping an instrument pack takes a little skill and practice for sure. So if you don't have the skill right away, definitely use the practice. But our outside pack is basically just a regular cloth wrap. We have lots of different sizes for different packs. I mean, our packs come from really big to kind of small. So I picked the right size for our general's pack. And then we have a paper drape here that is supposed to be waterproof, but it's not all the way waterproof. Basically what its purpose is to allow the steam and the pressure when it's getting sterilized to penetrate and get through to all the instruments, but it's not going to let any of the air or as much moisture as possible to get back to the instruments once it's done and sterilized. So you want to have that, and then some places use 2 wraps, some use 3. We like to triple wrap ours, and my third and most inner wrap is going to be a towel. This is just a regular towel. We have green ones to wrap and blue ones to quarter drape with. It really doesn't matter because they're all made with the same thing. And then we're going to have our instrument pan. And I'm going to set the instrument pan here. We usually pack these before we lay out our wrapping materials, but because we have stations, we have a cleaning station, we have a packing station, and we have a wrapping station, so that, like I said, we process through a lot of instruments. So we have kind of an assembly line here. So in essence, you don't want metal to touch metal as much as you can prevent it. So we're going to put a towel, it's the same thing as this one, on the bottom, so to keep the instruments kind of off the pan. That way it allows the steam to go through and all the way around your instruments. This pan has holes on the bottom to allow steam to pass through that way as well. So there is our pan, and I like to be nice and neat. So I'm going to lay my instruments kind of nice in here like this, and I'll show you the pack once I get done. All the instruments that can't be put on the ring, you just kind of lay neatly in the pan, and then you place an indicator in here. An indicator strip will tell you how much pressure, or if enough pressure has gone through to inside your pack. Make sure you put one of those in here. I'm not going to do that right now because I don't have an indicator, but always put an indicator in there. Here at A&M, we like to double check each other. So the person that packs it will put the indicator in, will pass it to the person who will be wrapping it, and the person who wraps it is supposed to double check you. That's to prevent any mistakes. I mean, we're all human, we all make mistakes, but the more times you can check yourself, better. So I'm just going to wrap it like this, kind of like a burrito. It's this layer really doesn't have to be pretty, just so long as you have your instrument covered. I'm going to show you what my instrument pan looks like here. So it's just nice and neat and basic. And then I'm going to wrap this like this. And since this is the first layer, it usually gets tossed or handed off to your scrub nurse, your surgeon, technician, whatever, or on your table. A lot of the time we don't have a lot of time to wait for someone to get scrubbed in, so we just toss things on our back table when we're ready. So it's important to have a piece of indicator tape. Now, this is indicator tape and this is regular masking tape. So that we don't have to use a ton of indicator tape because it's more expensive, we use masking tape on the outside, but we want to know that this green wrap has been sterilized and has been steamed well enough. And so on this piece of tape, it's got kind of a lighter creamed color, and it turns black. And I brought an example of what it looks like after it's been steam sterilized. So this is the before and this is the after. This piece of tape has been sterilized in a different pack. So I'm going to put the the regular indicator tape on here. And then from here it's kind of tricky. So it's going to be backwards since I'm kind of facing you, but you always want to start with the tab in front of you. And if you've noticed, I put my drape kind of in a diamond shape with the points going this way. So I'm going to hold on to my pack to keep it from sliding, and I'm going to pull this pretty taut, so if you can see me lifting the pack, and just lay it over the top. And then I've got a small enough drape to where I don't have to make too many folds, so I'm going to make the point towards me. And the reason why we make points is so that you touch at least of the pack as possible. So we always want to grab the point, or the tab is what we call it. I'm just going to tuck this so that it's a little neater, tighter pack. I'm just going to tuck the corner over here is what I've done, and then wrap this on the side. It doesn't matter which side you start first, but I say so long as you're consistent, it should be fine. And I'm going to take this tab and point it out this way. And I'll explain why when I open this, why I'm making the tabs in these certain directions. But it is important for whenever you're passing something, because you don't ever want to touch what's inside your pack because it's sterile. And when you're passing it off as a circulator, you're not sterile. So I just basically tucked the two corners, and now I have my top, and I'm going to lay it over my two tabs here, and I'm going to tuck it underneath all of them like so, and you want to hang on to this blue wrap because it doesn't have good memory before it's steam sterilized. So it looks kind of like an envelope like this. So you have your tab, which you're going to open later with the tab facing you like this, and I'll demonstrate that in a little bit. So same story with your outer wrap. You want to hold your pack down, kind of pull it tight, and this is going to be your corner. So I just have it down here. And essentially, the best practice is to cover every tab with the next tab. So that's what I'm trying to do here. I just tuck the corner and then lay it, and then tab facing this way. I'm just going to use this to hold what I have, tuck my fingers in here, pull it tight and over, and then same thing with the blue wrap, and tuck it in nicely here. So you have a nice envelope here. Now, when you wrap things, we have to go send it downstairs to we have huge autoclaves that steam sterilize multiple packs for us at the same time. So what we do is we tape these, and you should be taping them anyway. That's what we were taught at Bel Ray. We use one strip of regular masking tape, and this is what I was talking about to save money. Since this is so expensive, you really don't need a whole piece of tape of indicator tape to show that it's been sterilized. You just need a little piece. So I've just ripped off the edge so that the tape ends here, because no one likes to, when you're in a hurry trying to pass this off, you don't want to pull tape all the way around. You just want to pull it off and stick it to you, and then get on with your passing it off the instrument. So I'm just going to take a small piece, because it's going to be saving me money, tape it on here. And then that way, once it's been steamed, you know that these black stripes will tell you that it's been autoclaved. Now, in order to keep everything organized, because if someone else were to come and find this pack, no one knows what's in it except for me, because I'm the one that wrapped it. So we make sure that our department gets our packs back. So I'm going to put small animal surgery, or SAS, and then this is a general's pack. And then you always want the date, which I think today is the 9th or the 10th. I'm just going to put the 10th. And then my initials. Now, like I said, we have an assembly line here, so multiple people could either be washing and then they have to go do something else, and then a different person will pack it, and then they'll go do something else, and then a different person will wrap it. So you always want to put the initials of who washed it, who packed it, and who wrapped it. And since in this case it's me, I just put my initials, which are RR, and then a 3 beside it, so that covers the washing, the packing, and the wrapping. But essentially, if you need to put three sets of initials, you put those. So this is what it looks like, and you always want the date on here because triple wrapped packs, at least here at A&M, should be changed every 6 months. So if I don't use this in 6 months, we need to go ahead and rewash, repack, and rewrap it and sterilize it again. So that is packing an instrument pack. And then I'm going to demonstrate how to open one properly. So if I'm in a hurry, I'm going to do this much faster, but for instructional purposes, you want to take your tape off, and it's going to be much more difficult than that once it's been steam sterilized because the sticky stuff gets really sticky. You want to stick it to yourself because you don't have time to go, toss it in the trash. So I'm going to pull the tab towards me and over, and this is the only time your hand should ever go over your pack. So I'm holding it here at the base with the same hand, and you never want to switch your hands just because it'll eliminate you possibly dropping it, possibly contaminating it, or something else for that matter. And remember these tabs, I told you to point them. I only touch the corner, and I pull it out in the direction that it pulls out. And I'm going to tuck it in this hand. So that I can keep a hold of it, because if it falls, like if this were my sterile field, I would have to be way away from it because you don't ever want to get too close. So I'm going to pull this tab like this, and I'm not going over my sterile pack because essentially that blue wrap is sterile now, and then pull this one towards me. Now since I've triple wrapped this, you don't want to throw this over what's inside, which is our green towel, and then our pack is sterile in there. So I'm going to go ahead and drop this where I am. It's a lot quicker that way. You can always clean up later. And then same thing. So I'm going to pull this tab towards me and over. This is where you need to be careful about getting a hold of this blue drape. And this blue drape won't do this funny thing after it's been steam sterilized because it has a lot more memory. So you want to pull this tab to the left, so then it's exposing your instrument pack. This tab should go this way, and then your last tab will go towards you. And so if this were my sterile field, if we were going to toss it, you can either hand it off to your surgeon here, or you can gently toss it on the table like that, and then you have a pack ready for whoever's going to be scrubbing in first. As far as taking care of an operating room has a lot of things you got to keep in mind. So I'm just going to go through a few of the basics. Anytime you walk into an operating room, if you don't have specific shoes that you keep only for the operating room or for your back area, which we do back here, we don't have to wear booties. But I brought a couple of examples. These are booties. They go on your shoe like this. All of our surgeons wear them because they will wear their shoes out there in the clinic and then go meet like an infectious, wounded dog, and then you don't want them to come back in here with their dirty shoes. You don't want to track anything back into your OR. The best thing you can do to protect your OR is have everyone properly covering their hair, have a mask on, and anytime you walk into an operating room, have a mask. If someone's going to be trying to communicate to you in your doorway of the operating room, which I've seen this and heard about this a lot, ask them to put a mask on. It's not that much to just spend the time to put a mask on quickly, to just say a few words, put some booties on and a boof on. It's every little bit counts in the operating room as far as I'm concerned, and here at A&M we take every precaution. We're sticklers about everything, even to the point of tucking in our scrubs. It's become a habit for me, and a lot of people think it looks silly, but you're protecting your patient, and that's the main reason why we do everything here. Along with that, with your operating room setup, it depends on what surgery. So just to cover the basics, we'll go along with our general surgery. You want to make sure that your anesthesia machine's hooked up primarily, your table's in the right position and locked. You don't want to have someone lean on your table and go flying. That has happened. Make sure you have little things like the patient table ties, all your surgical equipment, like we call them case carts. Like we pull everything the night before for our surgeries. That way it's in the room and ready. And so you do as least as, just in case something comes in an emergency, you're more prepared and ready, and your surgeon will appreciate it. So as far as cleaning your operating room, we use a couple different products. Well, it depends on what it is really, but for our surfaces, like our back table, our patient table, Mayo stand, things like that. I brought an example. This is called Snap-A-Go. It's number 14. Number 6 is like a pinkish purple color. And then, so we kind of trade off so that the bacteria don't become resistant to either one of them. So, and they both do different things. So we just kind of use both here and there. But first thing you want to do when you walk into your room, if you're the first surgery, you want to wipe off the top of your lights because it will accumulate dust. A lot of people neglect top of the cabinets. You definitely want to wipe down your patient table first. Make sure that it's nice and clean for your patient. We clean our rooms pretty often, so we don't have to get like new blankets, but if it's been like a week or two since you've had a surgery, let's say in private practice, or maybe even a few days, I would go ahead and get new blankets. You want to wipe down your back table and your Mayo stand, basically any surface that's going to be sterile. You want to wipe it down. That way at least you know that that has been more or less cleaned off, so just in case something hits it, or if you rip the drape, you don't have to worry so much, just in case you don't notice it and they use that instrument or that blade, like if a blade pokes through the back table and you don't notice it till later and they've already touched the patient with it, you don't have to worry as much for contamination because you've already cleaned that surface and it doesn't have a lot of dust on it. Little things like that. I like to say and train our new student workers and even our new full-timers that this is your operating room. If it's your case, it's your operating room. It is your responsibility to make sure that everything stays sterile, that no one touches your sterile Mayo stand or your back table, that everyone respects your area and the patient, because everyone there is primarily for patient care. And if you're going to do anything at all, that should be your priority. So anything you do helps, and every little bit helps. So I hope that gets you at least started in private practice and you feel comfortable more in an operating room.